Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Hello, welcome everyone. I am Dr. Sarbajit, consultant neurologist in Apollo Multispeciality Hospitals, Kolkata.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So, see, our brain is a huge circuit. Whatever we do, think, feel, do, that that is governed by our circuit. So, if any unwanted electrical activity or discharge happens in a part of the brain or it rapidly captures the whole brain, then it is called a seizure. So some doctors say it as a storm in the brain or a short circuiting in the brain. So it can affect part of the brain or whole of the brain. That is seizure.
What is epilepsy?
uh, Epilepsy is tendency to have recurrent unprovoked seizures. If someone has a provoked seizure, like seizure due to a fall in sodium, potassium, or fall in blood sugar, that is unlikely to repeat again. That is not epilepsy. If someone has recurrent two or more episodes of unprovoked seizure, then it is called epilepsy. Then the person is said to have epilepsy.
What are the different types of seizures and do they affect people differently?
Okay. So I just said that seizure is an abnormal electrical activity that may originate in a part of the brain. When it originates or captures a part of the brain, or I can explain the word seizure. It comes from the word seizing. Okay, if that electrical activity seizes or hijacks the part of the brain, then it is called a focal seizure. So normal activity of brain will be jeopardized, and a certain type of spatial activity due to that misfiring or rapid firing of that part of the brain will occur. That is called focal seizure. If the electrical activity rapidly captures the whole brain, it will be called generalized seizure. These are the two basic types of seizures, and symptoms will depend on the type and the part of the brain that is activated or that is captured by the seizure activity.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Not always. Almost in 50% patients, we don't get a proper cause of the epilepsy even after thorough investigations. In rest half of the patients, there may be many causes that we can find. The most common ones are infection, particularly brain infection, an injury to the head, in stroke, or any metabolic problem, as I've explained, brain tumor, and neurodegenerative conditions in elderly like Alzheimer's disease. You may have heard of the diseases. Sometimes toxic causes like alcoholism, binge drinking, and alcohol withdrawal may also cause seizure or epilepsy. In children, another important cause may be genetic cause.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yes, that is very important for people to know. The most common and striking type of epilepsy that we know is called generalized tonic-clonic seizure, or GTCS, or convulsive epilepsy. Then patient goes through various stages, like the first the body of the patient stiffens, then the patient shakes violently and rhythmically, and after a few minutes the patient becomes totally unconscious. There may be some tongue biting or bleeding from the tongue, or urinary passage of urine or stool that may happen. And after recovery of the consciousness also, the patient may remain a bit confused for even minutes to hours. That is the most common type of epilepsy, but there are other types of epilepsy. One is important in children, that is absence epilepsy. What happens is that the child becomes absent minded, or just stares off, and his brain doesn't respond to external stimulus for a few seconds, and then he again comes back to consciousness and normal sense. Other other people will notice just that the child is just inattentive or staring at something else and not concentrating, but it is actually a seizure activity. There are some other types of seizure that may involve one part of the body, like one arm or one sided arm and leg shaking, or one abnormal sensation in one part of the body, or visual problem, or even psychiatric problems also. If we if you see this type of symptoms in anyone you know, you ask them or advise them to see a doctor, preferably a neurologist.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes, historically, from time immemorial, people have considered, people have seen epilepsy, person having epilepsy, and they could not explain it. The normal person, otherwise healthy, having abnormal periods of shaking or becoming unconsciousness, they thought it was uh, as if the person was possessed by some evil spirit or ghost or any. They could not explain that thing. Okay, so that's why there are so many stigma, whether this is a ghost or evil spirit or demon, those type of thing. Even some people think this is a psychiatric illness. It is perfectly a bodily illness. Like uh, if our is the normal rhythms of heart is affected, it's called arrhythmia. There are some drugs and pacemaker, those options. It's like same thing happening to the brain. Our brain waves and electrical circuit is misfunctioning, misfiring, and there are treatments. So nothing to uh, have stigma about it. Is just another medical condition. It is not contagious. Is The person is in most of the cases not malingering. So people should stop stigmatizing epilepsy.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
The most common triggers are skipping meal, less of sleep, stress, physical and mental stress, and alcohol withdrawal may be a stress or a trigger. Particular food, flashing light, fever, infection, those can be trigger also. And important another trigger in females will be menstrual cycle in some ladies. And most important trigger may be missing medicine. A person who is known to have epilepsy should take his or her medicines regularly, and missing medicines may trigger an attack of seizure. So the maintaining a seizure diary to note down all the triggers and medicine, that is very helpful for an epileptic patient.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Okay, as I've already discussed, eating regularly, not skipping meal, and not skipping sleep, having adequate sleep and rest is very important. Regular exercise is also important. Most of the epileptic patients are safe. The exercising is safe. So avoiding alcohol is very important. Relaxation is very important, avoiding stress, and forming a support group and having all family members and colleagues on board is very helpful. And obviously taking medicine is of paramount importance.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course.
Yes, so epilepsy is a very common condition. We should not stigmatize or discriminate the patients against the patients with epilepsy. Epilepsy, most of the epileptic patients can lead a full life. That means socially and economically productive life. Marriage, employment, sports, social gatherings are perfectly okay for most of the epileptic patients. They should avoid triggers, maintain the proper lifestyle, and take their medicines regularly. By that, they will in most cases, maintain a normal life.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.